Okay, I am talking about a disorder called schizophrenia. Schizophrenia is a very, very known disorder. If you see people talking to themselves, answering themselves, or even witness the person's thought process is irrational and they're acting out on it, that means they probably have a disorder. Who's those the process of irrational and behavior is considered not just only it's other causes that can cause schizophrenia, but also acting irrational and having hallucination can mean another disorder. But we're talking about the schizophrenia. These are a couple examples of some of the people with schizophrenia, such as people that hear things, hear voices, and also maybe even think another person is after them or out to get them. They hear voices more than they think people are out to get them. The control of thinking can be their thoughts in their head. Also, it can cause people to see other people as somebody to harm them, such as the symptoms cause a person suffering to become irrational, hostile, withdrawn from the others, and also even just off to themselves and they don't even know what's going on. It's called withdrawing from others. When some people hear the person with schizophrenia, the things may not make sense at times. They become still without talking and also without thinking. They might go around talking and you think they're talking to you, but they're not talking to you, they're talking to themselves. And sometimes they can become dangerous to others. Also, you should realize that when a person has schizophrenia, they don't make a lot of sense of certain things that they do. And also, schizophrenia can also run in the family. It can run in the family, and also, if ones are considering having a child, they should be tested for the disease. Thinking about like the transition of diagnosis of schizophrenia, full psychotic evaluation may be needed. Also, you can use lab testing, brain scan, to even may show some of the signs or symptoms of schizophrenia. And also, it might go as far as looking into your medical history, getting a physical exam. Also, in the healthcare profession, most of the time, a psychiatric profession is to diagnose you, inform you that maybe some members of your family might have some of the signs and symptoms, also maybe carry some of the genes of being schizophrenic. And they also might go as far as looking in your family history, medical, mental health problems that you might have down the road. And also lab tests is ordered, ruled out possible causes of the behavior, such as illegal drug use. Sometimes a profession might order a blood test or urine test. A brain scan causes find some brain abnormalities of the scan of people with schizophrenia have shown. The health profession will require about the family, personal health, and also some of the psychotic behavior they might have experienced. Also, they can even have difficulty with the school or work, or a parent also not taking care of oneself, like brushing their teeth, combing their hair, and just withdrawing from reality. Also, schizophrenia is a hard time organizing speech, hallucination, disillusion, catatonic behaviors. When a person may even shut down, does not want to speak to other people emotionally, and even has concerns about others. There's some of the other symptoms might present itself for 30 days. Only 2 of them may even require to be diagnosed as schizophrenia. That's from the National Institute of Health. The symptoms does not happen all the time. It does not show up all the time. Maybe might be there one moment, might be gone the next moment. People with schizophrenia, such as reality, have a hard time telling the real from the imaginary things. The person that's being treated for schizophrenia, sometimes the symptoms are less visible. People with schizophrenia may known as experience voices in their heads. They may even have difficult thinking. Experience is overwhelming. Treatment for schizophrenia is very difficult to do, and also they haven't really known a treatment for schizophrenia. It's unknown, but it's still possible to be antipsychotic with meds, psychosocial treatment available to be with the symptoms. And after a person has been on the meds, they can also go in regimen and start getting conventional antisocial. One of the persons in the regimen.
Hey, George, you want me to stop you?
Oh no, don't stop me. They can be in psychiatric treatment. These treatments are people to cope with daily lives and also maybe the things that involve daily lives. Schizophrenia can cause people to have hallucination, disillusion, and thought disorder. And also antipsychotic meds and psychosocial treatment or therapy are available to treatment with schizophrenia. As it mentioned earlier, schizophrenia symptoms can cause a person to be paranoid by thinking that other people are talking about them, which results in becoming hostile and mistakenly with others. If you or anyone in your family have any of these symptoms, please get diagnosed and see your doctor because it can be life altering.